Vaccine hesitancy among health professionals concerning CARICOM heads of government moving to address overuse of antibiotics, and efforts afoot to develop a harmonized policy for cruise ships to agree on the minimum health and safety requirements for cruise sailing in the Caribbean. Welcome to this week's episode of the CARICOM News Time as we continue our coverage of the 42nd meeting of the Conference of Heads of Government of the Caribbean Community. I'm Tusankin English Francis. Thank you for joining us. Vaccine hesitancy among medical practitioners is an issue of concern within the Caribbean community. Given the reality that the COVID-19 pandemic persists in 2021 and achieving herd immunity is still a work in progress, CARICOM heads of government have taken steps to address this concern. At the just concluded 42nd meeting of the Conference of Heads of Government, they learned through a presentation by the Pan American Health Organization, some health professionals are still hesitant to repose confidence in the COVID-19 vaccines. Against this backdrop, the Conference of Heads of Government mandated the CARICOM Secretariat, the Caribbean Public Health Agency, to collaborate with PAHO and other stakeholders in the health sector to identify strategies to address vaccine hesitancy among health professionals.
I think we have such an important tool now in this vaccine that we really should not miss the opportunity of protecting ourselves, being responsible to the people we serve, being responsible as healthcare workers, and really contributing to bringing an end to this pandemic, because vaccines are an important tool that will bring us closer to the end of the pandemic. All healthcare workers, not just those who work with COVID patients, all healthcare workers need to really understand what the evidence is. We should not be going to the places looking for information that John Public goes to. We should be looking at what's being published in terms of the evidence in the Lancet, for example, and what's being published in terms of the evidence from all of those peer-reviewed journals. So my approach is, bottom line, as healthcare workers, you have to know the facts, you have to know the evidence, and really make your decisions based on that.
And still on health, CARICOM heads of government are taking actions to combat what the World Health Organization has declared as one of the top 10 public health threats facing humanity. Heads of government are pursuing the setting up of a multi-sectoral antimicrobial resistance national action plans to integrate surveillance systems in human, animal, plant, and the environment. Antimicrobial resistance happens with the misuse and overuse of antimicrobials. Why it is critical and why does it require urgent attention? According to the World Health Organization and recognized by the CARICOM heads of government, the cost to the economy is significant. In addition to death and disability, prolonged illness results in longer hospital stays, the need for more expensive medicines, and financial challenges for those impacted. At the recently concluded 42nd Regular Conference of the Caribbean Community, heads of government endorsed a One Health approach to tackling this concern, given its threat to the entire society and to the tourism and the travel sector.
It is truly a big public health issue when we think about, for example, what's happening with gonococcal infection. The antibiotics that we have against gonococcal infection is no longer effective. And so it begs the question, how do you manage someone with gonococcal infection? The more you go higher up on that chain, the more expensive medications become, the more complicated it becomes to manage an individual. My message to anyone who is placed on antibiotic is that you use it properly. You should use it as prescribed, but you should also get your antibiotics from someone who is certified to give you that prescription.
As the tourism and travel sector begins its trek back to pre-COVID-19 levels, CARICOM is looking to incentivize intra-regional travel. The Conference of Heads of Government has asked the CARICOM Secretariat to compile a list of fees and taxes which are applicable at the region's airports. Even as CARICOM negotiates the delicate balance between lives and livelihoods, Director of the Pan American Health Organization, Dr. Carissa Etienne, has warned that public health must remain a priority to see benefits redounding towards accelerated economies.
Balancing public health measures while reopening the economy has been a challenge for every country in the world. But countries should avoid thinking that they must make a choice between reopening the economies and protecting the health and well-being of their people. We believe that this is a false choice. We have seen time and time again that full economic activity cannot resume unless we have the virus under control. And to attempt otherwise places lives at risk and extends the uncertainty brought by the pandemic. Health and well-being must be prerequisites for reactivating the economy in the context of COVID-19. Because if the pandemic is not brought under control, economic reactivation will be very difficult.
At their just concluded regular meeting, the conference received the first report of a draft joint tourism policy for CARICOM. They agreed to consider the use of a vaccination passport for vaccinated persons traveling by air and sea, supported by a digital vaccination database, possibly based on a model used in Barbados. Given the importance of cruise tourism to CARICOM, it is advancing the development of a harmonized policy for cruise ships covering both vaccinated and unvaccinated persons. Even while cruise tourism has resumed in the region, the CARICOM Secretariat, CARFA, and other relevant regional security agencies are to convene a meeting with cruise lines to agree on the minimum health and safety requirements for cruise sailing in the Caribbean. It's Olympic season and all eyes will be glued to TVs, cell phones, laptops, or whatever electronic devices with internet connections as we keep up with the performances of CARICOM athletes. They will be competing in disciplines ranging from athletics to sailing from the 23rd of July to the 8th of August 2021. The month-long event has retained the name Tokyo 2020, placing the spotlight on the disruptive nature of the COVID-19 pandemic that delayed the Olympics by a year. CARICOM athletes have traditionally brought the attention of the world to our region through their prowess in athletics. I know we will be cheering them on quite vociferously in our living rooms or whichever virtual space you may catch the games.
Throughout centuries, the Olympic Games have represented the highest form of international sportsmanship with the ultimate goal of cultivating people and world peace through sports, overcoming differences between nationalities and cultures, while embracing friendship, a sense of solidarity, and fair play. As chairman of our Caribbean community CARICOM, it is with pride that I extend best wishes to our 157 Caribbean brothers and sisters representing countries within the Caribbean space. Athletes, as you participate in the 2021 Tokyo Games, know that you are among the world's best of the best. Continue to strive for excellence in your sporting discipline. Fly your flag high with the pride, persistence, and resilience that make us Caribbeaners. I pledge my support, and I wish each of you every success. Much love and blessings.
For more stories, you can visit the CARICOM news site at today.caricom.org or the CARICOM website at caricom.org. Like our Facebook page, follow us on Twitter, and be sure to subscribe to our YouTube channel. Thank you for watching. Be safe and see you next time.